Hi, I'm Dr. Kuperan. I am an ear, nose, and throat surgeon and a sinus specialist, a rhinologist, who specializes in the treatment of nose and sinus disorders. I wanted to talk to you today a little bit about a procedure called balloon sinuplasty. Balloon sinuplasty has been around for over 10 years, and the technology for it has been around in the cardiac space for even longer, using to dilate blocked coronary blood vessels, and that's something that you might have heard of called angioplasty. So that same technology now exists for us to take care of patients with chronic sinus disease. So who's a candidate for something like balloon sinuplasty? So balloon sinuplasty is FDA approved and clinically indicated for patients who have a condition called chronic sinusitis. This is a sinus infection that has been present for at least 12 weeks and has not responded appropriately to treatment with oral antibiotics, nasal steroid sprays, and nasal saline washes. If your infection doesn't get better, it can lead to symptoms like facial pressure, discolored nasal drainage, yellow or green mucus, nasal congestion, stuffiness, or reductions in sense of smell and taste. So if you have those symptoms that have been lagging for a while, and this sounds like something that you're suffering with, balloon sinuplasty might be the right thing for you. Now, what is balloon sinuplasty itself? So basically what we do is we take a device called a balloon and we insert it into the nose, and we pass that device into blocked sinus openings in which there is trapped mucus or other inflammatory secretions that are part of the disease process. This is the actual balloon device that we use in patients while they're asleep. And so we introduce this into your nose, we get it into the blocked sinus here or here, and then once the catheter is in place, what we do is I have an assistant who does the inflating, and I hold the balloon device in the right location and I inflate the balloon like this. And when it inflates, this actually fills up with water and it becomes very rigid to a pressure of 12 atmospheres. That's a lot of pressure. And that causes the sinus opening to dilate open. So a lot of people ask me, well, how does it keep it open if it's just a balloon? Because once you deflate it, doesn't all that stuff come out? And the truth is that when it's inside that cavity, the bones of the sinus are these kind of very, very thin shale-like bones. And so when the balloon expands, what it does is it creates little microfractures in the bone, which then creates a new position to the sinus opening. And then in addition to this, opening up and dilating the sinus cavity, after the sinus has been dilated open, while the catheter's in the sinus, I have a port that I can irrigate through and wash the sinus out with the strong antibiotic solution to clear away any of those biofilms or chronically infected mucus to get the sinus to function normally again. And then after the sinus has been washed out, sometimes I'll place a little stent into that open sinus cavity to keep it in that open position so that it heals open and that allows that mucus to continue to drain. And those stents are bioabsorbable and they degrade over about a month. And so this is something that's very quick, it's very easy. We're not actually cutting out any tissue from the nose. We're using this to gently dilate and preserve your natural anatomy. So it allows your nose to function in the way that it's supposed to, but gives it a little bit of a competitive advantage because we're altering the anatomy slightly to promote better healing. Now the key is you want to make sure that you are the right candidate for it. There are some patients who are not good candidates for balloon sinuplasty, depending on how severe their sinus disease is, or if there's other inflammatory conditions that coexist with it. And that's where patient selection is key. You can get really great long-term success with the balloon, but only if you're using it in the right patient. And that's why seeing a rhinologist like me, someone with a lot of experience with taking care of patients with sinus disease, is critical, because sometimes you actually need sinus surgery, which is a little bit more invasive than a balloon procedure. And it really just depends, and it has to be evaluated on a case-by-case basis. There are a lot of different doctors that can do this procedure. Anybody who's board certified in ear, nose, and throat surgery is capable of doing a balloon sinuplasty. But I'm a rhinologist, which means that I've done additional training and certification, particularly in nose and sinus disease. I did a fellowship for an extra year after my residency in ear, nose, and throat surgery, where I learned extra surgical techniques and management of patients with sinus disease. And this is what separates me from all the other ENT doctors out in the community. And there's only a handful of us in Houston and in Texas who have this rhinology certification and training. And so you want to make sure that when you get your procedure done, you're doing it with the best possible person you can, with the highest level of certification and training for that particular procedure. And that's somebody like me. I've done thousands of procedures, whether it's sinus surgery or balloon sinuplasty, and taking care of patients with chronic sinus disease. So I know how to handle it, I know how to manage it, and I know how to make sure that you get the best result.